I'm an acute care hospitalist, nurse practitioner. I've been involved with infusions and vascular device insertion for 20 years now. IV dislodgements are fairly common in that they happen every shift, every day in a hospital setting. Patients get confused at night in the hospital and they don't know what they're grabbing or pulling. Transfers from a gurney to a bed. I've even tripped over an IV tubing that was hanging too low on the floor. IV dislodgements cause problems for clinicians, mostly because it delays care and it requires extra steps to solve that problem, so that's time spent away from doing other things that may be vitally important for patient care. The risks patients face potentially with IV dislodgements are the same for any extra procedure that you have to perform that's invasive. The risk for infection, nerve injury, arterial injury, the discomfort and pain of the experience impacts satisfaction. The safety release valve helps improve the efficiency of care for the nurses and for the hospital system at large. By having the safety release valve break and seal both sides of the infusion system when a tension event occurs. They just have to replace the safety release valve and restart the infusion. From the patient perspective, we can't emphasize enough how traumatic the experience of an IV can be. On average, it takes over 2 attempts to be successful for an IV restart. And if we can avoid unnecessary restarts for a patient, satisfaction scores would be something that would improve the efficiency or time spent performing care. It could take 45 minutes to an hour to restart a difficult IV, and you have to find resources to do that in the hospital. And a lot of times this stuff seems to happen at the wrong time, at night, when your resources are more limited. Disrupting the continuity of the infusion plan through inadvertent dislodgement is certainly an issue. An intensive care patient on a drip that controls blood pressure, patients that are on antibiotics, having some of the dose spilled out onto the bed or onto the floor, having the ability to avoid unnecessary restarts through something as simple and innovative as a release valve is a great idea.